Hi, I am Sam Bronson. I am a doctor of physical therapy here at EmergeOrtho. I've been working with our practice for the past 11 years. I received my doctorate from Winston-Salem State and a bachelor's of biology from Salem College. During my time at EmergeOrtho, I've become certified in dry needling, as well as I'm a certified kinesiotape practitioner. I do BFR through Owens Recovery Science, and I am a certified MDT clinician that specializes in treating the spine. Today I'm going to walk you through early physical therapy intervention and treatment of patients with acute low back pain. Low back pain is one of the things that affects most Americans throughout their life. As you can see, approximately 50 to 80% of adults will experience some form of low back pain throughout their lives. This is also one of the leading forms of disability among younger patients. So if you're less than 45, if you become disabled, more than likely it is because of low back pain. That low back pain that we experience, we see that approximately 8% of Americans, it will turn from acute to a chronic condition. Whenever you have that, that is going to affect your social participation, being able to go out with your friends, being able to do recreational activities, and may even impact how you're able to work throughout life. Now, a lot of patients do get injured when they are at work. We can see that sprains and strains account for 42% of work-related injuries, and majority of those things are going to happen to the trunk, affecting specifically the spine. So why is the spine so prone to injury? And really, to understand this, we need to look at the anatomy of the spine first. Now, when we see this diagram, we can see that the vertebrae has got several different structures. The big portion that you see, that is the vertebral body. So that is the part that lines up with the different segments and it forms a column. You see jutting off of it a couple of different spinous processes. So one spinous process coming from the back, and then two transverse processes coming out through the side. And then of course that nice big opening is called your foramen. So that's where your nerves actually pass through. So we want that space to be big and open. Now, when we look at the disc, so the disc is that blue structure in the corner, it has two separate components. It is the outside, which is the annulus fibrosus, which is basically its connective tissue that holds everything together. And then inside of that is what we call your nucleus. So the nucleus is your jelly-like filling, and it's what squishes around and helps provide shock absorption when you're doing a variety of activities. Now, when we line up the entire vertebral column, on the front and the back side, you're going to have two ligaments that run the entire length of it. The anterior ligament, the one that's in the front of your body, is going to be a lot thicker than the one that's on the back of your body, the posterior ligament. And in addition to that, that posterior ligament is thinner, but it also has little spaces, so that way things like blood vessels can pass through them. So when we develop disc-related issues, most of those are going to occur posteriorly or behind us. Now, this is because a number of different factors, okay? Number one, when we bend that annulus, so that connective tissue that's on the outside of the disc, it actually stretches to about 60% of its normal height. So it's got a lot of tension under it. Also, when we are doing any sort of forward movement, the nucleus inside of the disc will start shifting within 3 minutes of a sustained position. So even if you're just sitting on the couch, if you're slightly slumped, after a 3-minute time frame, we're going to see that that nucleus starts going more and more and more to the back of our spine. Whenever you do that in combination with the annulus stretching, you're putting your body at risk for that injury. Okay? Plus, that posterior ligament is no longer the same thickness as the front, so it's not going to give you as much of that protective barrier as you would from the front. In addition to all that, the most common thing that we do during the day that causes a problem is that flexion rotation movement. So in a workplace, we typically flex 3,000 to 5,000 times a day. We don't usually go backwards unless we're standing upright or you're doing an overhead activity such as painting. An average office worker will actually sit for approximately 10 hours a day once you throw in your commute and your evening activities as well. Now, anytime that we see that you're sitting for such a prolonged period, this is going to increase your prevalence of low back related issues. Now, you may not have the same severity of low back pain, but for a lot of patients that sit for a prolonged period, you have a higher risk of being hospitalized than, say, someone who has a heavy endurance activity like a lineman or a forester. Whenever we look at these things, we want to make sure that we are changing our position more frequently, because anytime we are bending forward, we're increasing our risk of having that injury. As you can see in this little diagram right here, 30 degrees of flexion. So you think about you're bending not even halfway down at that point in time. If you do that for more than 10% of your day, you have a significantly higher risk of developing back-related issues over time. So anytime that you are doing a hygiene task, like you're washing your legs or washing your face or you're putting shoes on, you're bending more than that 30 degrees. So it takes very little time for that to become more of an increased risk. When we look at like more specific kind of activities, so you think about someone that does a heavy physically demanding job, like this is an example of someone that works at UPS. Occasional transferring below the waist is all that their job requires, okay? But in their definition, occasional is 33% of the time, which exceeds the moderate risk factor for developing low back related issues. So what can you do to help yourself if you get injured? So whether this is on a weekend experience, if you are at work or something like that, how can you help yourself over time? Well, first thing that would be recommended is to get evaluated by a physician or a PA if you feel like you have any concerns, okay? This is to help rule out any underlying aggressive diseases or if you have any issues such as fracture, okay? Because we want to make sure that no matter what, you're stable. So especially in injuries where we have a fall or if we have a collision of some sort, you may want to get looked at first to make sure we rule out those fractures. In addition to that, whenever you see the physician, they may recommend some sort of medications or injections. They also may just say rest, ice, heat, over-the-counter medications, and they may also recommend physical therapy. Now, in North Carolina specifically, we are a direct access state. And that means that you do not have to have a referral from any sort of provider before you can get evaluated by a PT. You can come in off the street and ask to be put on the schedule for an eval. Now, that doesn't mean that your insurance is going to necessarily cover it. A lot of insurances do require that referral from some sort of outside source to be covered, so do verify that before you go that route. But it is always an option for you. Now, what benefit can we have with early physical therapy? When we see patients earlier in the clinic, it may not be a huge activity list that we do to start off with, because really, when we first see you at an acute injury, we are trying to help manage your symptoms. We're doing different interventions to help modulate your pain, help restore normal motion, and prevent bad body mechanics from developing because of these pain-related symptoms. So it may not look like a normal therapy session if you've had something like for your knee or your shoulder in the past. Our goal is to start reducing pain levels and to improve nerve health to start off with. And in addition to early PT, you are welcome to continue taking the medications and those sorts of things that are provided by your physician in conjunction with what we do. Now, we can see the long-term benefit of early physical therapy. And for these studies, they say early physical therapy is we start seeing you at like the 3-day mark post-injury. But by doing so, we reduce your chances of developing a chronic condition. So at 1 year post-op, patients that get early PT have a 2% risk of developing chronic symptoms as opposed to 15% if you were to delay treatment. Also, you're going to usually see fewer work days that you're going to miss because of your pain, as well as a reduction in overall opioid use. So that's actually a 10% reduction in the amount of opioids that patients that receive early PT versus long-term PT. And as we know, we are definitely trying to do things as quickly as possible to avoid those sorts of addiction type tendencies. Now, how do we know when to go back to the physician? Well, most of the research out there shows that you are going to have a significant improvement in your symptoms within the first 75% of your visits. So in a 6-week time frame, so usually we see patients twice a week, that means by the end of visit 5, we should be seeing that improvement in your symptoms. We should have a very good estimate as to if you are going to continue to benefit from PT. And as well as your body is naturally going through its own healing process. The first couple of weeks is where you're most inflamed, but then you start going through actual healing and symptoms will start getting better on their own, and we can adjust quickly and start providing more exercises that are appropriate for you at that stage of your recovery. Now, if you don't progress within that month-long time frame, this is when we say we want to make sure that we go back to the physician for further evaluation. And this may include things such as that advanced imaging. Now, we don't necessarily need advanced imaging ahead of time because unless you have a red flag symptom, and that is what we're looking for on that first eval day, we can see that imaging will show a lot of underlying conditions that may not be your pain generators. In asymptomatic adults, so adults without back pain or issues, 90% have some sort of degenerative disc disease. Okay, 36% are going to show some sort of herniated disc, but these are patients that don't have any problems. So advanced imaging is not necessarily needed unless we see that there are concordant symptoms that go along with it. The method that we use here at EmergeOrtho, we typically use the McKenzie method. This is the method that I am certified in. And all the previous statistics that we have given you have been doing, including exercise and passive interventions such as manual therapy, stretches, modalities, but they don't adhere to a specific program. McKenzie method is a program that was introduced back in the 1980s as a way to classify and more effectively treat spinal conditions. It provides a logical procession through the evaluation all the way through to your full recovery and getting back to normal activities. On staff, we have 3 certified MDT clinicians, myself included, that we see the predominance of our spinal therapists. But if you're at any other facility and you want an MDT clinician, you can find them through the McKenzie website. The first day when we're evaluating you, we are going to get a thorough subjective history. When did your symptoms start? What have they changed over time? Where are they currently? What makes you feel better? What makes you feel worse? Do you have any red flags? Okay, those are the things that we want to look at first. And then after that, we start measuring you. We look at your strength. We look at your motion. How well do your nerves move? Are you having a lot of tension with those kinds of things? Are you having any reflex issues? And if we need to, there are special tests that we can do to look for more concerning conditions as well. And just from having your history and your measurements taken, we can have a very good understanding of what we need to do for treatment, okay? How we progress you. We do this through a method of classifying your symptoms. The first one that we look at is your derangements, okay? That's the first classification. It is the most common. 75% of patients that have some sort of low back pain are going to fall into this category, so it's the one that we treat the most often. And all this is an obstruction to how your joint moves. We think about your disc herniations. That forms an obstruction. It's taking up space where it shouldn't be. So usually we can get these guys to move. They can change rapidly. They can improve quickly with just a few simple movements. And that's what we're hoping most people are going to fall into. Now, the other categories that you see listed here, dysfunction is a chronic condition. It happens whenever those tissues have healed, but they've healed kind of shortened. It's just another thing that we see and we recognize, but we know that that's not going to be our fresh back pain patients. Posture is just what it sounds like. We need to work on how you sit, make sure you're moving more frequently, working on those body mechanics, that sort of thing. And then our other is literally everything else. So it's your fractures, it's your post-op surgeries, it's our patients that have stenosis, in which case, if we can classify you into that category, we still know what treatments we need to go through to make you feel better. It's just going to look a little different from the other evaluation process that we do. Once we've decided that you are in fact a derangement, our goal is to find your directional preference. So which way do we move you to make that obstruction feel better? And if we can find that, it's going to allow for healing to take place. It's going to allow for those symptoms to start moving out of your leg theoretically. And that allows you to move more comfortably, sleep better, restore normal movement patterns. These are usually categorized by those rapid changes, but it is very important that we adjust it based on your symptom presentation. So we may need to change force or load. So we want to be seeing you regularly so we can make those quick adjustments. The other part that goes along with this is the education, okay? So with this, it is important that you understand what the condition is happening to you, how long the time frame for healing takes place, understanding that movement is medicine. It is okay to have soreness, but it shouldn't make your leg symptoms worse. So as long as we can recognize those things and we understand that, you have a better chance of recovery. Follow-up visits, this is when we start doing your normal strengthening. Anytime you think about therapy, you're like, oh yeah, they're gonna make me work. Okay, great. We want you to work because SOR is safe, okay? That movement just helps promote healing. It shows that you are having a change in your tissues so that they can grow stronger. But we don't like sharp pains. We don't like stabbing pains. We don't like things that make your legs worse. So our goal in therapy is to not make those things happen. We want to make you stronger, but we don't want to irritate anything further. So a lot of education will go behind these things. And we do use manual therapy or modalities such as e-stim or ice or heat or massage as needed, but the research supports that a patient who does active participation, so doing your strength training and your stretches those kinds of things, you are 60% less likely to have a recurrence of symptoms in the future if you're an active participant as opposed to just having things done to you passively. Once we've gone through those full ranges of movement, we want to make sure that we are getting back to our normal function. What do you want to do? Do you want to go back to a CrossFit routine? Do you just want to pick up your grandchild? Okay, making goals that are tailor specific to you so that way we can work towards them and making sure you regain your full motion. Some patients may even qualify for something like a work conditioning program if they got injured on the job. And that is something that also we can look at doing to improve just overall stamina and full body strength. Now, once you've had this happen to you, unfortunately, you are more likely to have a recurrence of symptoms. Majority of patients, if they're going to have that recurrence, is going to happen in the first year after their initial incident. And that's just because tissues heal slowly. So it can take up to a full year for your tensile strength of your tissue to improve and they become less susceptible to that re-injury. So we want to make sure that we're still doing our program. When we find a program that works well for you, so if you respond to one movement versus another, we want to make sure that you are still doing that with some sort of regularity at home. Because if you do so, you're much less likely to have a flare-up of the symptoms during that first year after your injury. In addition to that, still working on your core strength and improving your lower body strengthening and using good mechanics to help reduce those risks of injury. And the biggest thing is movement is medicine. The more often you can change your position throughout the day, it starts reducing those risks of having those injuries and of course using good body mechanics to help reduce those kinds of injuries as well. And in addition to this, we say get PT first because everyone knows the bottom line is a good thing. Patients who had PT first as opposed to an MRI spend an average of $4,793 less than if they had gotten the MRI first. So when in doubt, go to PT. So if you start experiencing an acute onset of low back pain or leg-related symptoms, go visit EmergeOrtho.com and schedule an appointment.